Today, I talk with Neal Mercado, who is the Chief Science Officer at Melrose Health, who has developed a new range called FutureLab. Neal has over 25 years' experience in the global complementary medicines industry with an emphasis on product development and research. He has held C-suite positions in marketing and innovation at Ecofibre and for Designs for Health. He was Director for Research, Development and Emerging Markets for BioCeuticals, and prior to that was Director of Global Product Development at Blackmores, as well as Director of the Blackmores Institute, and was an Adjunct Fellow at NICM at Western Sydney University. Hello and welcome to the Health Chat. I'm your host, Vicky, and today I'm talking with Neal Mercado, the Chief Science Officer at Melrose Health, about the new and exciting range called FutureLab. Hello, Neal.
Hello, Vicky. So nice to be here.
It's great to have you. I'm so excited because I know you've worked very hard on this range, and I thought I'd give you an opportunity to talk about how you came up with this range and what was sort of the reasoning behind it. And then we'll dive deeper into the actual products themselves, and I'll ask you some specific questions. So yeah, tell me about a little bit about what led you to this unique range.
Yeah, well, look, I've been in this industry for a long time, and I've always wanted to kind of have a carte blanche to create a range for longevity. And joining Melrose, the company is really focused on supporting Australians as we age. I'm a dual citizen, so I can consider myself an Australian. And kind of, we've really identified the importance and how it just seems to be this this connection that's happening right now, this intersection at this point in time where everyone is starting to think about their age and not necessarily even just maintaining age. So we've got a lot of drugs that can help keep us alive, but wanting to really live a quality life. So not just about lifespan, but your health span. And so we saw that it wasn't really being addressed very well. And so we've got a great team here. Nathan Chong is our CEO, and I think you've had him on the program before as well. He says hi, by the way. And I've worked with him a few times in my career, and we just had a lot of fun pulling this together and really choosing throughout our career all of the actives and the ingredients that we feel have the best research and are the most effective for each particular part of healthy aging.
And before I dive into that, because I want to explore that a little bit more, but what makes this particular range so unique? What is it that sets it apart from anything else, not just in Australia, but probably anything else that I've seen anywhere?
Yeah, well, we started with the research. We started with where the leading minds are taking us in the longevity space, and the areas that we wanted to support, which we kind of understand quite well from the standpoint of your cellular longevity, your cognition, your muscles, your bones, and your metabolism, your metabolic health. So starting with that platform, looking at the actives that we have access to that are the most efficacious, the most clinically trialed, but also what's different about this range is we've been able to utilize some new and emerging technologies that can help improve and enhance the absorption, the usability, the bioavailability. So it's not just, providing standard nutrients, but it's providing those that have been studied clinically in published research and that are advantaged. So we're very excited about it.
And you were talking a bit about, targeting each particular area, so the bones, the muscles, etc. And when I was looking through the products, I noticed that they're very, very simplified. They are not complicated at all, which I love because it's like, I need something just for my brain. I know exactly what I can take. I can take that. But I feel like that this range was developed with the ability to take what you need, right, without overcomplicating or over bombarding the body. Was that bit behind that?
Absolutely. So, I've had a lot of experience with practitioner brands, and what's key, what's very important, are protocols. So the ability to utilize different products, different formulations together in a more precise way for the individual to help with their needs. So you're absolutely right. These products can be utilized together synergistically, and, to provide wide scale benefits for what works for you. So for me, I'll tell you what I'm excited about is our NAD booster, our cellular longevity product, our Berberine complex, and our muscle protein complex. But I also, as I age, and I just turned 50 in March, I'm starting to get a little bit of inflammation and some arthritis. So our inflammation modulator is something that I also am taking.
And so you're talking about the uniqueness of the ingredients. What is there in some of these that sets it apart, do you think? The form?
Yeah, we're using three different technologies to enhance the bioavailability. We use liposomal ingredients. So liposomals are fairly new. They've been around for a long time in terms of being able to enhance and improve bioavailability. They're small spherical structures that has a phospholipid bilayer and an aqueous core, or it could also be a lipid core. And that could be like a micelle, and they're encapsulated. That improves the stability, and it also, because of the complex matrix, the lipid matrix, it has an affinity towards your cell and improving absorption. So that's one. We use a technology very similar to that from a very reputable herbal extract company called Indena, Italian herbal extract company, and they use a phytosome. So that also enhances absorption and bioavailability. And it does that through also a phospholipid. But they also include some other active phytochemicals as part of that act synergistically with the active. And the third one is a new technology actually that is created right here in our home country. In fact, in Sydney, from a company called Pharmaco. And this is the liposperse technology. So this is like a cold water dispersion technology. It's very good for lipophilic actives like resveratrol, quercetin, things of that nature, that help it become, it almost improves and enhances the surface area. So it improves that bioavailability and absorption as well. And there's some great research, I think we'll probably get into it, but our Verisperse, it's a trans resveratrol, it was shown to have 2 times the bioavailability and absorption area under the curve in humans, human plasma pharmacokinetic study. So that's, you can take 150 milligrams and you'll get double the amount versus of a Verisperse versus taking a standard resveratrol in your blood. So it's great.
All right, so let's talk about that particular product first. Let's talk about the cellular longevity, because you touched on the resveratrol. So you mentioned it's the trans form. And I know why you've chosen, but I think it's important everyone else understands why that particular form was put in this product.
Well, we know, that there's cis and trans. Trans is the more biologically active and stable form. We have a limit in Australia as to the amount of resveratrol that we can use in listed medicines. So we're utilizing the maximum that we can in there. And we're using a very high quality form of that. So we use the Verite trans resveratrol form, and it's complex with the liposperse technology, as mentioned. So the product is designed, it's 150 milligrams of resveratrol and 400 milligrams of quercetin. Both of those are complexed in the liposperse technology because quercetin as well is poorly absorbed. It's a lipophilic active as well, but it's got some great research on it from the standpoint of sirtuin activation, autophagy, AMPK activation, inflammation. We know it's great for histamine function as well. As we learn more about this, it's such a fantastic active. So we really want to utilize that together for sirtuin activation, reducing free radical damage and oxidative stress, autophagy, clearing
Yeah.
cells as well. It's a really important part of keeping our body healthy.
Yeah, I've read some really interesting research in that space where they gave some mice resveratrol, and they had two groups, one that was eating a normal diet and one that was in a fasting state. And the results were comparable just by one group taking resveratrol. It was like they were activating that autophagy. It was incredible to read. So I want to go back for a second about the dosage, because this is really important. I myself take about 1 gram of resveratrol a day. And so if your product, how many milligrams per dose? Is it 150?
It's the maximum, the maximum that's allowed in a listed medicine.
Yeah.
So as a practitioner, you have access to a higher amount than that. But for the general consumer, 150 milligrams. But that, as it's complex, so it's kind of so the area under the curve, plasma was 2 times, but the Cmax, the maximum amount was 4 times the versus a standard delivery. So you could have between 300 to if you're having 2 serves, 600, but the Cmax is going to be double that again.
Yeah. Oh, that's really good. See, that's the one I'm excited by, that particular product, because that means a lot. Yeah.
Sure.
Now, the quercetin that you put in there, you were talking a little bit about sirtuin activity, and I think that's important for some of the listeners to understand what that means.
Yeah, so look, we know sirtuins. We're just learning a bit more about sirtuins and how they can help. How it's a family of enzymes, plays a really important role in a lot of functions, stress, cell growth, cognition, metabolism, and just overall longevity and healthy aging. We know that NAD also enhances sirtuin. So there's a few formulas that we have that are beneficial from that perspective. There's a number of sirtuins as well. And they can help to regulate cellular senescence as well. Lots of age-related cellular processes, oxidative stress, inflammation, inflammatory response, mitochondrial damage, and autophagy as well.
Yeah, and I noticed there's quite a nice healthy dose of quercetin in this product. It's not small at all.
Yeah, 400 mgs. Yeah, and again, we've complexed it utilizing the same lipid technology. So we don't have a plasma trial, but leveraging kind of what's happened with a similar molecule, lipophilic and poorly absorbed resveratrol. It's definitely going to be a lot more readily absorbed and usable.
So,
You get a lot of for your buck.
So we'll go to the NAD booster, because I feel these two products kind of go hand in hand, right?
Yeah.
That's the way I would take them anyway. I love this formula because it's very simple, but you've got an ingredient in there which I think is often overlooked that needs to be paired with this. So I'll let you talk about that, and then I'm going to ask you why you chose one over the other. But I'll let you talk about DMG.
Okay. Yes. So our NAD booster is a combination of 300 milligrams of liposperse, a complexed nicotinamide riboside. So again, it's bioavailable enhanced, and dimethylglycine. And it's 150 milligrams of dimethylglycine. And we know that we've used, so as you think about NAD boosters, NAD precursors, you've got nicotinamide, you've got nicotinamide riboside, and you've got nicotinamide mononucleotide, NMN. Now in Australia, you can use nicotinamide. People get flushing. Nicotinamide riboside avoids that flushing, and is converted into NAD. It kind of goes through a cellular process. But we've chosen NR. There's some great research on NR at the dose that we're providing. So there's a great study using 300 mgs, 8-week randomized trial that demonstrated a 51% increase in NAD within 2 weeks. But we know as well when you are increasing NAD, the body recycles it. It can be recycled into more NAD, or it's excreted. And when it's excreted, it's broken down into methyl nicotinamide. And when that happens, it grabs onto an important methyl group. Particularly as we're learning more and more about, with Gary Brecker and the importance of methylation, healthy methylation, the different polymorphisms that are around there, the MTHFR polymorphism. We know if you're not methylating well, you can have out of whack homocysteine levels. It can impact neurotransmitters and DNA methylation as well. So we think that it's important if you are taking an NR or NMN, anything that you're doing to increase NAD, we feel like it's important to have some type of a methyl donor as well. Now there are, you would say, well, the trimethylglycine, so you've got 3 methyl groups attached. That's great, but again, that's not allowed as an active here in Australia. But what we feel is the next best thing is dimethylglycine, so DMG. So that's why we've used this formula and why we've created it, and I can tell you that it works. I had some today, and yeah, I can feel the difference, and it's individual, right? But I can tell you, for me, it really works.
Now I want to ask why you chose nicotinamide riboside, because I've taken both NR and NMN, and I'll be completely honest and say I get a much better result with NR, and I do take it with either a DMG or a TMG. But why did you guys choose NR over NMN?
Part of this is because of the access, is because of, these products are designed to be available. We feel they're practitioner strength formulas, but they're available to the general public. They're not restricted through practitioner only. As a result of that, we have to follow the Australian Register of Therapeutic Goods allowed ingredients. Right now, NMN is not allowed as an active ingredient in listed medicines for sale in Australia. It's only allowed for export. And you can get it through extemporaneous compounding as a practitioner, as I'm sure you are aware, and probably how you get it, but it's only allowed to obtain then as a single active. So under those regulations, as you know, right, you have NR that's converted to NMN that's converted to NAD. So some people think, all right, NMN is better because it's closer to NAD in that conversion pathway. But we also know there's actually some emerging evidence that suggests that NAD is raised indirectly by increasing the metabolites that's used in the synthesis. So that's much like, it's a larger molecule. It's a little bit harder to absorb, like NAD. Like, you can't just take NAD and expect you're going to increase NAD. So you're using the metabolites. And look, as I mentioned, there's probably a little bit more research, human research on NR for NAD than there is yet on NMN. Not to say that there won't be more with NMN, but it works. It works at the dose that we're providing, and it's allowed for sale. The TGA reviewed it and said, "Hey, this is safe, this is effective, and you can use it."
Oh, it's definitely effective. No doubt, it's definitely effective. It's like having a couple of coffees. I can't live without it. That is the absolute truth. Even when I travel, I have to take a little stash with me, and then I go through customs. What's this? It's just NMN and NR. Don't worry about it.
Don't worry about it.
Very suspicious.
Give me energy, this white powder. Don't you worry about it.
So true. So I take about 1 gram of NR a day. That's my protocol. And I'm wondering, because this is liposperse technology, right? What sort of equivalent could I take in your formula to give me a similar sort of dosage with what I'm taking now?
Yeah, that's a really good question. So I'm going to speculate here, and I'm going to leverage based off of what we saw with our resveratrol and the liposperse technology, and the data that's available around NR. I would say, but a lot is, you're right. The rage is to kind of consume 1 gram of NMN. But what I do know is taking 300 milligrams has been demonstrated to increase your NAD levels by 51% over a placebo. So if we think about that as it relates to liposperse, well, you could potentially double that, so 100% increase in NR, utilizing the technology in kind of 2 weeks. So I think it would probably be pretty darn consistent. But I think it would be great to get your individual results and how you feel when you're doing each. Do you use a methyl donor when you take NMN currently?
I do.
Yeah.
Yeah.
Great. Great.
And that has made a significant difference for sure. It's very interesting because I did read some research about how long it takes for something like this to kick in, like NR for it to kick in. And every piece of paper that I read was something between 10 to 12 days or 2 weeks roughly. And I have to say that mine was a lot quicker. I managed to get a result. I don't know if it's just because I was in desperate need of it and my body just sucked it up and went, yes, you need it. But likely, how long would it take for someone to notice the effect of the booster?
Yeah, so you're right. The data is around 2 weeks. I can tell you anecdotally, for me, I take it, I feel it honestly within like 10, 15 minutes. Like it is experiential for me, but that's also it could just be unique to me and unique to you. Maybe as we age, we know we make less of it endogenously. So it could just be that we need this. It really helps us to kind of keep us vibrant, which I guess is what we're all looking for, right? We're looking for something like this to help us feel more vibrant, to feel more energetic, to feel more switched on, more kind of activated. I can tell the difference.
Oh, there's no doubt. The switch onness is profound. The way that my brain works now is unlike any other time in my youth, no doubt.
Yeah, fantastic. I have tried NMN. I've tried it in the powdered form. I've tried 500 milligrams and 1 gram. Personally, I didn't feel the same. Then this is just me to when I have been taking RNR. And granted, I've only been taking it a couple of days because we've just come out with it. But I'm really looking forward to seeing how you feel.
Yeah, well, I'll definitely be taking your NR. I want to move on to the Berberine Complex, and I love this formula because I'm thinking it's going to go off the chart, to be honest. I really do. I think this is an area that everyone is, because of Ozempic, for example. But I want to talk a bit about this because when I see this, I think about my patients who are suffering from high cholesterol, diabetes, or some sort of glucose metabolism problems. I look at PCOS, I look at insulin resistance. This is where I see this product myself. And again, this product only has 2 ingredients, so it's really simple and clean. And there's a unique ingredient in it that I'll let you talk about. I noticed some of the research talked about this form having 4 times the absorption, higher absorption than berberine chloride. And I thought you could talk about this a bit because it's super interesting.
Yeah, so our berberine comes from a beautiful Italian herbal extract supplier called Indina, who I think are one of the leaders in researched phytochemical research and herbal medicine research in the world. And we use their berberine called Berbevis. And this is, I mentioned a little bit about the bioavailability enhancement called a phytosome. So what they've done is they use a proprietary, this complex of phytonutrients and phospholipids that stabilize the berberine, enhance the solubility and the absorption. And there's a great published human clinical trial that demonstrates a 4 times increase of absorption area under the curve versus just a standard unenhanced form. So what that means is, berberine is much like resveratrol, much like quercetin, it's poorly absorbed. It's got a long history of use in Ayurvedic and Chinese medicine, actually, but it has low bioavailability. So you have to take it. You have to take a lot of it, and it can be very harsh on your GI system. It can be very harsh on your microbiome. The beauty in this is the way that they have complexed it. They use a grapeseed extract and a little bit of pea protein, actually, that helps to make it usable, but also gentle and easy on the stomach, so you don't have to take as much to get the benefit that you can have, and you don't have to worry about kind of going on and off of it for the impact to your microbiome, because that's one of the downsides. So you can take this. It's effective. It's safe. There's a lot of really good safety data on this particular ingredient. And it's a single dose. It's formulated at 550, which is the clinically trialed dose. And it's specifically for healthy metabolic well-being. So it's so important. How you metabolize glucose and how you're able to keep that your metabolic health healthy as you age. So there's a lot of benefits there, as you pointed out. Cardiometabolic parameters, lipid, triglyceride health, healthy metabolism, healthy redistribution of adipose tissue as well. So these are all, I think, really important outcomes.
I'm really glad that you spoke about the ability to stay on it long term and its minimal discomfort, because that's one of the drawbacks. I think whenever I prescribe berberine, I'm very conscious to say to the patient, you can only take this for like about 6 weeks, and then you've got to come off it for a while, and then you can go on it again. And I'm sorry to say, but you have to take this after every single meal, and you may not notice its effect on your stomach initially, but I took it to trial it, not because I needed it. I just wanted to know what it was like. And I did notice that after about 3 weeks, I was like, oh God, I don't feel good. This does not agree with me at all. And I thought, I don't feel comfortable suggesting this to patients. Whereas this product, if you're suggesting that it doesn't have those sort of effects, I feel very comfortable recommending this.
I'm very sensitive personally. My GI system, I can tell if I have, particularly to alkaloids. And it really does impact me. I can tell you, I've been taking these. I will take one in the morning and one in the evening. I'll kind of spread it out. My next test is to try to use a continuous glucose monitor. So I'm going to get one of those to see. I'd love to. Our chief marketing officer, Michael Davies, has done that. He's kind of looked at his continuous glucose monitor. He's like, oh my gosh, I didn't realize how terrible white rice is for your blood sugar. But I'd love to see that. But absolutely, I think it's just such a great herb, and this doesn't impact my GI system. I feel fine on it, which is great.
What is the expected sort of weight loss for Berberine Complex, and how does it compare to some of the pharmaceutical medication?
Yeah, so look, there have been some data published on Berbevis and weight loss. Now it's hard to say. Obviously, Ozempic, GLP-1 receptor agonist, it's a drug, and it works quick and it works effectively. But like with a lot of drugs, it doesn't have the same safety profile as other things. So we do know berberine activates AMPK, which you see in fasting and exercise states. What we have seen in 30 days is a reduction of visceral adipose tissue of 16%, and at 60 days, a 22% reduction in visceral adipose tissue. Now, again, that's just one trial. It's not to say that everyone's going to see that or experience that. And I don't know how that compares to to Ozempic. I mean, I think that's quite rapid. It's probably a lot more, but I can say that you don't have to inject it. And it doesn't cost you $1,000 a month. And it's a more natural approach, we think, completely agree.
So let's move on to my next favorite product that I'm going to go on, and I'm going to put my husband on. Not that we're stressed, but we're just, in these days, we're building a house and it's very stressful. So I'm looking at this, I'm going, this is my next product. And I know that this is the Neuro-Stress Modulator is designed to reduce stress using a very unique blend of two. Look, I know what those herbs are. I just don't know those new terms that they use. And I'm sorry if I say it incorrectly, but it's Nuganda, liposomal ashwagandha, and Holixa, holy basil. I mean, that sounds so beautiful. So
Yeah.
I want to hear you talk about these unique forms and what this particular formula is designed to do.
Sure. Yeah. So I when I was in the US, I met a guy named Sebastian Balcombe who has a company called Specnova, and Specnova make fantastic powdered liposomal extracts. He's real, true liposomes. You can have fake liposomes. You get people that claim liposome, but they're just complexing, phospholipids in with an active. But these are true liposomes. And he's created this extract called Nuganda. And this is a really interesting extract of ashwagandha in that it delivers on the adaptogenic benefits that you would expect from ashwagandha, but it also helps from a cognition enhancing perspective as well. It's got two published trials on it at the dose that we're using, and the outcomes were elevated mental agility, reaction time, balanced cortisol levels, reduced feelings of stress, anxiety, so this is standardized to withanoids at a very a really great level. It's very bioactive, and I just think in terms of its usability, again, we're enhancing it with, it's standardized. We're enhancing it with the liposomal technology. It works really well. It's got some great published data around stress, cortisol, but also cognition. And similarly with Holixer, this is a clinically trialed form of holy basil. This utilizes an enhanced technology as well. They call it the bioactive optimization technology that helps to really get standardized as well. And a number of clinical trials on this, 4 clinical trials for everyday stress, acute stress. There's a stress on it, or a trial on it for healthy kind of sleep quality, and quality of life. So this also helps with cortisol levels, and it's we think it's just it's a great active. I love holy basil. It's one of my favorite herbs, and this just in terms of one that has some good published data on it, Holixer is a great option for trials. So between the two of these, there's 6 published clinical trials, each at the dose that we're using. And again, I think this is going to be great for your husband.
It's going to be great for all of us, because I know that holy basil is really excellent for people that can't seem to see the light at the end of the tunnel. When you are so bogged in the stress of life, the holy basil just gives you, it's so gorgeous and calming, and it just makes you feel, it'll be fine. It'll be great. So I'm looking forward to this product myself. I'm looking forward to my house finishing, but I'm really looking forward to this product.
That can be very stressful.
The next one that I want to discuss is the Cognition Nootropic. And, when I was looking at this, I mean, okay, there's 2 ingredients in this. One ingredient, I'm like, I can see why that's in there. That makes complete sense. But so it uses bacopa and sage, but I'm intrigued about the cognitive health effects of sage from this particular formula that you're using. And I don't know if I'm pronouncing it properly. Is it Sibelius?
Sibelius, yeah, Sibelius sage. So this has 2 clinical trials on it. It's been developed actually out of Cambridge in the UK. It's a patented form of sage, 2 clinical trials, one that demonstrated improved memory and attention in older volunteers, and another one that demonstrated improved cognitive performance in young, healthy adults. So it's experiential. It works very, very quickly, standardized to rosmarinic acid. You wouldn't, yeah, I agree. If you think about cognition, you're not necessarily thinking about sage, but this is a really unique extract that, and you know, I'm really excited about the kind of the experiential nature of this ingredient. It's really, I think it's really going to be one that you feel.
Yeah, and tell me, is this formula physically stimulating at all?
Um, I don't believe so. I have not felt physically stimulated. I've felt mentally switched on.
Mm. Oh gosh.
Just like kind of like calm cognition, not like, you know, honestly, like NR to me is physically stimulating. Like
Mm.
I get a kick from NR, but from cognition, it's kind of like this calm focus, and just this real dialed in.
That's
Oh, I was going to talk a little bit about the other active that's in there, and this is also from an Australian company here called Network Nutrition. One of the pioneers of herbal medicine in our space, Ryan Gorman, has developed this formula called Ebel One, and we know, like you said, you know about Bacopa. Bacopa has been used for years. Lots of traditional evidence on this, but the interesting thing is that when Bacopa, so you've got the active ingredient in there is our bacosides. But when bacosides are used in the body, they're actually converted in your GI system into the ebolin lactone. And that's what has been done with this. So they've been able to almost predigest the bacosides into a form that your body can utilize. So this is standardized to 10% ebolin lactones. And again, with this, you feel it. It's experiential. It happens really quickly. You know, you hear about 5-HT2A allosteric modulators. So a lot of, you know, as they think about psychedelics, right, and how they promote neuroplasticity, they utilize this same receptor activator, and that's what this is designed to do as well, is to activate those same type of receptors, obviously without the psychedelic experience of microdosing, but this, you know, in a Bacopa, this is an exciting, novel, interesting extract of Bacopa.
And so what age group would you recommend this? I'm thinking about university students or even, you know, year 11, year 12.
Yes, absolutely. Any like students, 100%, you know, I think are going to get a really good benefit from this, and aging. Like my parents are getting older, they're not like Joe Biden's situation, but they're certainly can use a little bit of cognition enhancement. So they'll benefit from this as well.
Yeah, that's good to know. I'll let my daughter know. And you were talking at the very beginning of the podcast, we were talking about how you've noticed, you know, some arthritic pain and you're taking inflammation modulator. And this is another great formula. There's just two ingredients in here, one that I'm very familiar with, one that I think can get a bit more exposure. And I thought I would like you to talk about this a bit more, this
Yeah.
particular product.
Sure. So this is our inflammation modulator, utilizes another Indina herb, Mariva curcumin, a phytosomal curcumin. This is probably their most clinically trialed curcumin. So over 40 human published clinical trials, over 2,000 subjects demonstrating support for inflammation, joint health, eye health, liver health, kidney health as well. You know, curcumin is also poorly absorbed, and the phytosomal nature of this has demonstrated a 30-fold increase in absorption for this particular product versus just standard turmeric extracts. We have this in at the dose that's used in clinical trials, which is 1 gram, so 1 gram per serving, and we're also using an endocannabinoid. here called PEA. So endo, this is a cannabinoid that your body will make naturally. It's naturally produced. And it has an impact, our endocannabinoid system, PEA has an impact on inflammation and pain, stiffness. So yeah, I definitely, that's one of the things that I have felt over the last year is just this increased inflammation kind of in the morning and different times of the day. This is going to be a staple for me, and to be able to utilize probably the most clinically trialed form of curcumin, and this real, I think, interesting, novel new pathway of inflammation, the endocannabinoid pathway, in an endogenous endocannabinoid at that, I think is really unique and effective.
And so how long do you think, I mean, it's very difficult to discuss, I suppose, but if someone's got some pain like yourself, how long did it take for you to notice some relief?
Yeah, so this is one that will act for in a little while. Like for me, it's going. It almost is like you don't feel it straight away, but then you kind of feel it if you stop taking it. Uh, so I think for me again, this is about 2 weeks, regular use, and it really makes a difference for me.
I see this one as being very popular because I know a PEA in particular for some people just works brilliantly. Like, and this combination I can see will do very well, especially you said a 30-fold increase in absorption. I mean,
That's right. Yeah, yeah. It's a fabulous extract.
so what dosage would you recommend for acute pain in this case?
Yeah, good question. Look, the data is on 1 gram, so that's two caps. So in our product, this is a 60 cap offering, so a month supply that we offer. So I would say use the amount. I think if you need maybe a dose response a little higher, you could double that. But it's in there at the effective therapeutic dose as it stands. All these products are that we formulated are designed. We're providing a 30-day supply utilizing the therapeutic dose that's been used in published clinical data.
Now, not that I need this because I'm one of those people that can fall asleep very quickly and very deeply. I have a problem getting out of bed, but this particular product, Deep Wave Sleep Booster, has got a couple of very interesting ingredients. And I'd love for you to share some of the research behind these two ingredients and what this product is designed to do.
Yeah, thank you. So Deep Wave Sleep Booster has two actives. We're utilizing the alpha wave L-theanine. So L-theanine was only recently allowed in listed medicines in Australia. And we're utilizing the clinical trial dose of that, which is 200 milligrams. So there are 3 published trials on alpha wave. It's designed, it does what it says. So alpha waves, in terms of its uses are the type of waves that you're creating alpha waves when you're in a state of deep relaxation or meditation. And so it smooths out neurotransmitters. So, I don't know, well, I get this where I can't go to sleep and I'm just like, oh, I forgot to do that. Oh, what about this? Oh my gosh, my mind's just racing and chattering, and it's just that neurotransmitter activity from what we've been doing. We've been so busy all day and we can't calm down our neurotransmitters, or maybe we've been on our phone scrolling. Well, L-theanine is great for that. It's great for smoothing out neurotransmitters and just kind of promoting a relaxative state. And then we were using the Relissa phytosome from Indina, lemon balm, Melissa officinalis, and standardized, double standardized actually to hydroxycinnamic acid and rosmarinic acid. So this has 2 published trials, and we're utilizing both of these at the dose that's been utilized in the clinical trial for improving your quality of sleep. And it's not going to you're not going to have to wake up feeling groggy. We didn't want to use, valerian root because of that. Some people are kind of allergic to valerian root. We can't use melatonin here. We think that this is a really nice, natural, herbal, effective form to just promote great, good quality sleep, which is so important for healthy aging.
And is this in a powder or a tablet capsule? What form is this?
Yeah. So each capsule, 200 milligrams of each. So it's a 30-day supply. You need just to take one.
What age group can we start using this product? From what age?
Yeah, well, look, the products are designed to be 18 plus, but there's really nothing in here that I would feel uncomfortable recommending for a younger individual as well, if able to swallow capsules.
Because I'm thinking about those students that have exams and can't switch off. They
Yeah,
need to wake up feeling alert rather than feeling groggy. That's
I
what I
think
was
it'd be
thinking.
great for that.
And now we'll move on to vascular health, which I think I have to consider for myself because of my age as well. I noticed an interesting ingredient in this product, which I never heard of before. It's called red night
Ah,
beetroot concentrate. And I'd
yeah.
love to hear you talk about this. And why would someone need this?
Sure. So the vascular health product is a combination of four actives in this one. So we're utilizing vitamin D and vitamin K. So we know that vitamin D and K have a strong relationship with arterial health. And We use MENA-Q7, vitamin K2, tons of great clinical trials on that. And they work synergistically. So the way that I like to think about it is kind of vitamin D helps with calcium absorption, and vitamin K helps to take the calcium that's in your arteries and deposit it in your bones. That make kind of it's an easy way for me to think about that. CoQ10 is really important for heart health, but as you point out, red night. What is red night? Red night is a beetroot concentrate standardized to natural nitrates. And nitrates are very, very good for nitric oxide production. And so we think of healthy vasodilation, healthy blood flow, healthy blood pressure. We know that nitrates are involved in nitric oxide production. This one has 10 times more nitrates than beetroot, and 10 times more antioxidants. And it delivers natural nitrates with betalains and polyphenols as well. So it's a great, I think nitric oxide production, there's more and more emerging evidence and research around the importance of nitric oxide production and healthy cardiovascular function and regulation.
This looks like a very interesting product. I wouldn't mind trying this myself. And now we'll move on to bone matrix because, again, I'm probably at that age group where I need to consider this. This has a lot more ingredients than the other products, but I can see why they've been put together because they do work very synergistically, especially like the D3 and K2. But I'm interested to know more about the calcium hydroxyapatite. Do you mind talking about why that form of calcium was used?
Yeah. So we use two forms, the hydroxyapatite form. The hydroxyapatite is actually the form of calcium that makes up the majority of calcium found in our teeth and our bones. And what it does is it gives them their strength and hardness. So it's a natural form found in the body. So many supplements will just use calcium carbonate, and it's high in elemental, but it's chalk, right? Like there's so many better options in there. So we use an amino acid chelate form, a glycinate, calcium glycinate, it's a stable, bioavailable form, and hydroxyapatite as well. And then we also use a magnesium glycinate, an amino acid chelate form of magnesium, in addition to that. So we've got 200 milligrams of calcium and 150 milligrams of magnesium per serving, in addition to that D3 and K2, which, as we know, is so important for healthy bones.
And again, is there a particular age group this is designed for, or is this broad?
It's broad, absolutely. It can be utilized, and you're not too early to start looking after your bones, kind of your bone mineral density.
No, that looks like a great formula too. Now, I know that you guys have got a vitamin C liposomal form, and there's just that one ingredient. I'll let you talk about it.
Yeah, it's a pretty simple vitamin C, liposomal form. Again, it comes from Specnova, utilizing their LipoVantage liposomal technology. There's a published clinical trial on it that demonstrates a 20% increase in plasma vitamin C. And lots of liposomals are offered in liquids. This is a liposome that you can have in a capsule. So it contains 300 milligrams per serving. Fairly simple. But vitamin C is so important for so many functions, and this is just an advantaged, clinically trialed form of vitamin C.
It's great because sometimes liposomal vitamin C can taste a bit off-putting, whereas
Yes.
taking it in this form would be great. I have suggested with your Melrose liposomal form of vitamin C that people use it topically. I actually do use it topically on my skin.
Yeah, absolutely.
And I can see this would be great because, you just prick the thing and you put it on your face as a mask. It works wonders, especially on people that have got scars. Without a doubt, hands down, the best thing to use is this form of vitamin C.
I agree. Yeah, and liposomes they will penetrate. You can get that absorption and utilization through the dermis.
Yeah, it's a bit sticky. You do have to wash it off. You leave it on for 10 minutes and it does better job than the $150 item you can buy from Mecca.
Well, maybe that's why you look so great, right? Same age as me, right? You don't need
And
Botox.
Botox. No, it's all the liposomes. And let's talk about muscle protein complex, because I actually did a podcast, I think it was not last month, the month prior, about sarcopenia. And I have a huge interest in this space because, again, with age comes some of that concerns with muscle health. So please go right ahead, talk about this. And then I'll ask a bit about some specific ingredients.
So this is a really unique and effective formula, and to be honest with you, this is one of my favorites. So if we're just launching it now, but it's got some great ingredients in there. So number one, we've got 25 grams of protein, and more research. Rhonda Patrick, there's a lot of great people who are with great minds studying the importance of maintaining muscle mass as you age. It's what leads to falls. It's your ability to stay healthy, stay active, keep that your muscle health up. Weight-bearing exercises are so key. So we're using some clinically trialed ingredients. So 25 grams of protein, but we also use 15 grams of that protein. It's all collagen protein. So it mixes beautifully. It's virtually tasteless and mixes great. It's a powder. So we use Gelita's Body Balance collagen, and that has 9 published clinical trials on lean body mass and fat mass. Stimulates the mTOR pathway. It's great for protein metabolism, great for muscle strength, particularly with resistance training. There's some data demonstrating the use of HMB and D3 as well. And a recent clinical trial that was published has shown that in elderly, the use of HMB and D3 improved muscle function in older adults, even without exercise. Now, I think we should be exercising. I think we should be, doing weight-bearing exercises, particularly with our legs as well. I think that's so critical. But HMB is without a doubt the ingredient that we have in all of our products with the most clinical trials. So 667 published clinical trials on HMB.
Wow.
Just an amazing body of work and evidence. And it's derived from leucine, and it decreases muscle protein breakdown, increases synthesis, and it's much more potent than leucine, the branched chain amino acid leucine, for promoting strength gains. So I'm excited about this. I think I personally need some more weight-bearing exercises myself, and I've started to kind of do that. And I think this is so easy to take. You can mix it pretty much with anything. I honestly take it with coffee. So in the morning, I'll just chuck a serve in with coffee, and it's almost like a creamer.
Yeah.
So I'll have that, and then I'm getting 25 grams of protein, getting all the beautiful collagen benefits and the HMB and D3 benefits. So I think this is going to be a real star.
Well, you were talking about HMB, and I think it's important we just talk about that a little bit in case some people are unaware what that is. So would you mind briefly explaining what that is, what HMB is, and how does it work?
Yeah, so HMB is an acronym it stands for beta hydroxy beta methylbutyrate. It's a metabolite from leucine. So as we think of amino acid amino acids found in protein, we think of branched chain amino acids. And of those branched chains, leucine is probably the one that's the most important for muscle health. And HMB is a metabolite of that. So I think I mentioned it's unique in that it kind of decreases muscle protein breakdown and increases muscle protein synthesis. And leucine also does this, but HMB is much more potent than leucine. And there's tons of published data on HMB. And actually, so in order for muscle protein synthesis to happen, leucine actually has to be converted to HMB. So you're kind of giving the pre-converted form, the form that's ideal and important for maintaining muscle mass, maintaining strength, and increasing physical performance.
I think that was a really excellent way to summarize it, because there is a little bit of confusion surrounding that particular ingredient. And I do love the way you've explained everything in such detail. And I will make sure that the chapter markers associated with these particular ingredients and products are listed below. And like I said before, the way that they have been formulated is wonderful, because I thought I just needed 2 or 3 of these products, but as you've explained it, I'm like, oh no, I need that and I need that.
Oh, I know. I can use them all. And that's what I just love. I love creating products that I want to take. And that's this range it's not here, and it doesn't exist. And so it kind of now it does. Now I've got things that I can take that I will be taking. And it'll help me on my longevity journey. And I think it'll help a lot of Australians as well.
Yeah, it's wonderful. I love the range so much. The FutureLab range is now available, so please look out for it when you're there next. I'm pretty sure it has a really nice section that has been dedicated by the sales team in the health food stores. Thank you so much, Neal. It was wonderful speaking with you. I've really enjoyed it. You've taught me so much.
Oh, thank you, Vicky. Thank you so much for having me on. It's been a joy. I could probably spend another 5 hours on here just talking to you. But yeah, thank you so much.
Oh, it was wonderful. Have a wonderful weekend. Thank you, everyone.